Okay, I'm gonna call this special meeting of the Moore County Commission to order, and this is the public hearing for the enactment of Moore County Ambulance Service Ordinance, the repealing ordinance NC-C-4-98. And I'll just go through, how the public hearing will be held, so everybody knows what the procedure is here. So, the first thing we're going to have is we're going to call for a staff report and a summary. And the commissioners will have time to question the staff. Next, we will call for comments from the public for anyone in favor of the ambulance service plan. And then we will call for comments from the public for those opposed to the ambulance service plan. Then we will close the hearing, the public hearing, and the commissioners will deliberate. And as far as if you're testifying, or as an individual testifying, must state their full name and town of residence for the record. And as well as sign in on the sheet. Do we have a sign-in sheet back there?
Oh, no.
Okay, if you want to testify. And then there's not going to be a time limit. This isn't the same as a comment period like at the commission meeting. So we don't want to limit you if you have, but we ask you to keep your comments to the substance of the ASA plan and what the hearing is about. We ask you to do that. If not, if it just goes on and on with something that's not related to the substance of it, then I'm going to ask you to wrap it up. So that's the way we want to do it. So with that, we'll start with I'll call for the staff report. I'll turn it over to Matt Johnson.
Thank you, Chair. As far as the staff report go, I'm going to just give a short background on the substance of why the county's taking this approach to bring in this new ordinance, and then we have Bob Blackmore online as well, and he'll address some of the legal requirements and everything on this.
Could you identify him when you did?
Yes, Bob Blackmore is the legal consultant that the county hired due to expertise on ambulance service plans. We dealt with it in several different municipalities and taking care of these things. So the genesis of this is when back in 1995, the Morrow County transferred ambulance service over to the Morrow County Health District. In doing so, they established them as an ambulance provider. Before that, there was North Morrow County, South Morrow County ambulance providing through volunteer services. Morrow County Health District since 1995 has served the county quite well as far as providing ambulance service, mainly coordinating the volunteer response that was used for ambulance services through those years. During that time, ASA has been updated in 1998. There's been other ASAs changes and revisions, but from our record, there doesn't show consistency in following all the requirements to have those accepted and taken care of by the state. OHA has a responsibility to review and kind of give a blessing on that before the county adopts it. And depending on the county's viewpoint, the last one that's really certified and adopted was the 1998 ASA ordinance. One of the issues that we have is once it's been provided, ambulance service has been provided by a single provider for all these years, even though the ambulance service plan and they had multiple ambulance service areas. Since 1998, they had several different areas, including Boardman, Irrigan, one for Hermiston, which covered the Butter Creek area. Arlington covered areas along I-84 and the west side of 207 in that, well, heading up to the Arlington, Hefner junction on 84, and then you'd have the Hefner of the South region. And so there's always been multiple ASAs in the plans, but it's been generally one provider with some additional help from logically near outside county resources. This largely worked quite well. And one of the issues, though, that we discovered is the ASA plan allows for more than one provider. It always has since 1998. It provides consideration of other providers. But when our ASA was crafted back in 1988, and the language has been used in the other ASAs that have been considered but not formally adopted, is that we were kind of an aberration across the state. Instead of the county being the administrator of the ASA, it had been assigned to the health district, which meant the health district was the determiner over the service that was provided, which with volunteers, that makes perfect sense. When you have other providers coming into it, that it suddenly becomes an issue. And in doing so, it creates a provider in charge of other providers. So there were some issues in 2022, 2023, the previous Board of Commissioners, and a request from Boardman Fire Rescue District to provide their own ambulances. That was referred to the previous Board of Commissioners deferred cleaning up the ASA and just asked the health district and the fire district to try to negotiate some way to contract with each other to provide those services. Those discussions terminated and did not proceed. And so there's been this issue of how do we clean this up? This board has taken on the challenge of doing that, acknowledging the years of service that the health district has done, but also acknowledging that in an environment where there are paid providers that we have to pay for it, and we've evolved from a volunteer EMT-based system, that there needs to be a separate level of consideration, that the county needs to reassert their responsibility as managing that plan, and then allowing the process to be able to select and provide providers to make sure that the life and safety issues with the county are taken care of as far as the residents and visitors. This has been a protracted process. Part of that is doing due diligence. The commission held several different town hall meetings last spring and to get input. Then without a county administrator in place, though, there was a little bit of lapse on that. While there was progress being made, we had an interim county administrator, and then when I came on in August of last year, this commission firmly put this is a priority object, and we need to get this taken care of. We've made advances along that, and as we looked at the plan, Bob Blackmore was the legal consultant on that. And the approach was to take the structure that was there, the ASA there, and to make modifications of it rather than scrapping it and doing a whole new document, which has its pros and cons, but also using the structure that was there. The plan changes. The plan that is before the Board of Commissioners right now is largely still the same plan that was in 1998 and was comparably used in the one that was brought before the commission initially in 2022. There are some changes. One of those is that where it asserts the county's role as being over the ASA Advisory Committee. That was another change from EMS Advisory Committee to ASA Advisory Committee. Also changing the composition of the advisory committee. Previously, that was set up with members from volunteer members from all the areas. And as Morrow County Health District took it upon and made it a paid institution, suddenly that advisory committee became very heavy with Morrow County Health District related employees. whether they're paramedics, EMTs, physicians, or whatnot. Suddenly that advisory committee had a preponderance of its members as being health district employees. This creates some conflict and some, as far as how do they open up to consider other providers that is not health district related, and as well as reviewing their own cases and such. So one of the changes is to create the advisory committee to be more agnostic and not directly related to any of the providers. There is provider representation on that. There's also representation from the 2 local hospital districts that help, the hospital centers, including Morrow County Health District and Good Shepherd in Hermiston. Those are the 2 that receive most of the calls that we come through in our county. There's also a change to include the fire districts, representations from the fire districts on this advisory committee. By law, fire districts are the legitimate first responders. And ambulance, while it is an EMS action, can be incorporated with those or called upon to provide service and such. And so, in fact, in many municipalities, you see the fire departments respond and then call in the ambulance if necessary. Right now, we're looking at members from each of our fire districts through here. There is one important note that was pointed out. When we submitted this to OHA for review, we had not put the Lexington Fire Department as part of the ASA Advisory Committee. We need to make that amendment before you have any of the reading or take action on it before the end of this meeting. So when that time comes, we'll do a separate motion to amend, and I'll let you know the line and where that needs to be put on. But we do need to add that in there.
I'm going to ask the council, Justin, we're holding 2 hearings on this, correct?
Yeah.
So we're not going to close this hearing or make a decision.
So.
We're just going to hold it over till our next meeting.
I think the ideal, so I'm trying to think over our process. If we're doing public testimony here, we're just closing it and then doing the next meeting for delivery.
Right. We'll have public testimony this time.
Mhm.
We will not make a decision. The commissioners will not vote this time. Because it'll be held over till the next year.
Closing the public hearing and then setting over discussion for the next one.
Right, with no public comment,
I believe that's correct.
correct? Okay.
Yes.
Yeah. So before we take final action, we will, I would like to make a note that we need to have that consideration taken. That is an outreach that we did. We could have just done it on the posting that we had, but I'd like to have, since it wasn't in the other one that we presented to the commission, we just want to make it as a formal comment and amendment from your side. As we go through this, as I said,
Yeah, I think he might be.
and
Yeah, I'd rather definitely defer if Mr. Blackmore their comments on that. I think he's been working on it more than me, so I better make sure.
yeah. And Bob, you're available to you're unmuted.
Can you hear me?
Yes.
So with regard to process, I think there's actually 3 motions that need to be heard today. One is a motion to approve the addition of Lexington to the ambulance service plan. The second is a motion to approve the first reading of the ordinance by title only. The third is to approve the certification of the that is contained in the plan itself. And then I guess it's the fourth one is the motion to approve the ambulance service plan by title only. That doesn't, you have 2 readings. So the first reading, you approve the first reading. You go to your next meeting. At the next meeting, you have a motion to approve the second reading of the ordinance by title only and approve the ordinance. So you do have votes today. You have a number of them to take, and I can walk you through that when we get there.
So, appreciate that, Bob, and I'll turn it over to Bob in just a minute, but, just a reminder that this discussion and the hearing that we're having today is about the ambulance service plan itself. This is not, we are not discussing, providers at this point. That process will take place after the plan is, adopted and in effect, in order to establish the initial providers to operate under the plan. So this is specifically on the structure and the makeup of the ambulance service plan. With that, I'd like to turn the time over to Bob, Mr. Blackmore, for a little bit more of the legal insight and comments as you'd like to share.
Thank you. First of all, I just want to remind everybody that the Oregon Health Authority has approved the ambulance service plan that you have in front of you. The ordinance was an exhibit to that ambulance service plan, is in an integral part of the plan because there has to be a showing of enforcement authority and process. So it's all been approved by OHA. They've changed their process a little bit because what they have told us at this point in time, we want to prove it in advance. We're going to do our final approval in advance. Once it gets to the county, we want you to approve it. If you then approve it, send us a certified copy of it and we'll consider it complete. So this would be the only time you vote on it. It doesn't have to go to the OHA and then come back to you again. They've already done their final review and approval. So, and I want to say that OHA has been wonderful in this process. They've been very attentive to it. They have had a whole team of people working with us to get it done in a timely fashion. So there are a number of significant changes from where you have been in the past. And Matt has commented on the control by the county. That's not a wish list by the county as much as it's a legal requirement. The 98 plan it simply gave all control and approval of every facet of the ambulance services in the county to the health district. That was, in my opinion, unlawful. It was an illegal delegation. It was improper. Shouldn't have gone that far. What we're trying to do is realign the ambulance service plan with the statutes and with the administrative rules so that everybody understands that the table of contents is established by the Oregon Health Authority. They tell us how to number them. They tell us what they want in what order, and so we have to follow that process. In beginning this process, as Matt indicated, we have very much wanted to follow up on the 22 plan by the health district. They had a lot of good information in that. We've included a lot of that. There's been substantial discussion with the health district and fire district and others with regard to the plan. And I believe we've addressed all of those plans, at least as we present it to the board for your consideration. One of the benefits here is that the previous plans, the 98 plan and the 22 plan, did not really address mass casualty connectivity with the emergency operations plan of the county. It was operating as a separate silo. One of the things we discovered in going through this is that the mass casualty plan was simply really a mutual aid type control at a scene issue, and it didn't incorporate the emergency operations plan of the county. It didn't incorporate the emergency manager for the county. It didn't include the mass fatality plan. So there were a number of things there that were not addressed and needed to be addressed and brought into the overall program for the county. So that's a huge benefit going forward. And I think it's going to be one of the first issues for the ASA policy committee to look at that, or advisory committee, excuse me, to look at that and reconnect with emergency operations and make sure that we have better connectivity there and that's worked through. The other part of this that is going to be a major issue moving forward is response times. In 98, you had response times that really 20 minutes, 4 hours, that they have very long response times. 22 plan repeated that. Oregon Health Authority was not happy with that at all and wanted to have shorter response times and to address those more specifically. We don't have the data at this point to do that. The county needs to generate that data, have discussions through their advisory committee, and come up with new proposals on what response times can be and what the goals are going to be 90% of the time. I'm sure you're going to have quicker response times in the more heavily populated areas, longer times in other areas, but they can also be adjusted seasonally. They can be adjusted for weather. You can have all these considerations put in there. So that's going to be a significant new change as the county moves forward. Providers do have the right of first refusal, and that's in keeping with the previous plans and proposals. The ASA Advisory Committee is made up of fire districts. Obviously, there's, I think, 4 fire districts. There's the members, there's 5 medical members, and there's a 911 member. So you have Morrow County's public health director. You have representatives from 2 hospitals, Pioneer and Good Shepherd. You have the 911 system. So you have good representation throughout that. You also have the supervising physicians or designees from each ambulance provider. If there's more than one, you have more than one. If there's just one, you have just one. So those are some significant changes that I think are going to improve this substantially. Let me see. So I also am aware of some public statements made by the health district with regard to the 98 ordinance. I just want to remind you that the county does have authority to repeal its 98 ordinance. You don't have to deal with that ordinance, and it was so fatally flawed in so many ways that my advice was is appeal it and move on. Get a new plan together that addresses these matters. And so all the issues about the 98 ordinance are simply not relevant. It's going to be repealed, and you're going to be moving forward in a new fashion. There was also a question with regard to map boundaries and with the cost reimbursement, the cost-based reimbursement issue. Kind of surprised that showed up there because we've had extensive discussions with council for the health district about that. There were changes made by Medicare over, I think it was last summer, redefining what those are and how they're structured. And so the plan is set up so that should they have a portion, the ASA 3, for example, that it will not impact their cost-based reimbursement. And we've provided their council with all the information that we were able to obtain from, actually had to go back to Washington, D.C. as they were making amendments to their whole program. And there was a comment about implementation of new rules. I think there's basic misunderstanding there about when you adopt ordinances, you have hearings, you listen to people, you talk to people. When you have resolutions and orders, you do all of that. You get input from the public, you get input from the ambulance service providers. So to put a long period of time for implementation may not be appropriate. You can address it, and maybe it would be appropriate in that specific issue. So in any event, I think you're well set up at this point in time moving forward. And I want to thank you for the opportunity to work with your county staff and with the board.
Great, thank you, Bob. First off, I want to ask something. Did you get those 3 motions down so we're ready to go? Or do we need to have him repeat those now to make sure we get them word for word?
If Bob could repeat the first one where I mentioned motioning to approve the addition of Lexington, they didn't get all of that.
Okay, let me, okay, so I think you need to have a motion to amend the plan to include Lexington in the advisory committee.
And that's Lexington Volunteer Fire Department.
So that would be the first motion. The next motion
She's
would
getting that
be,
down. I'm sorry, Bob. Want to make sure you keep it out there.
Yeah.
Okay, you're good. Go ahead.
okay. The next motion is to approve the declaration that is in the plan. That's on page 1 of the plan. It's entitled Certification of County by Morrow County of County Ambulance Service Plan. So it's a page that each of the commissioners needs to sign, and they make a certification that, you know, there's 3 different issues there that you have to address and approve. So you have to read that and make sure you're all in agreement with that. And in essence, what you're certifying to is that each subject or item contained in the plan was addressed and considered in the adoption of the plan. Number 2, in the governing body's judgment, the ASAs established in the plan provide for the efficient and effective provision of ambulance services. And number 3, to the extent they are applicable, the county has complied with ORS 682.205, paren 2, paren 3, and ORS 682.335, and the existing local ordinances and rules. Okay, so that's number 2. And then the third one is that you need to have are you ready to go forward?
Yes.
You need to have a motion to approve the first reading of the ordinance by title only. The BOC then votes, and if approved, the clerk reads the title of the ordinance into the record. And then you have a motion to approve the first reading of the ambulance service plan by title only.
Okay. Now, just to reiterate, I think you might have covered this. Do I adjourn at the end? Do I adjourn the public hearing or, and then?
Yes.
Okay.
Yeah, you adjourn this meeting at the end of the
Yeah,
day,
okay.
and then you hold your second meeting as you've indicated in the notices.
Yeah, okay. Okay, does anybody have any questions of either Matt or Bob? Any of the commissioners? Yeah, you got it.
No,
Okay. All right. That concludes the staff report, Bob.
Pardon?
That concludes your report, right?
Yes, that
We're gonna-
concludes my report.
Okay, we're gonna start taking public testimony now. Okay. Okay, that concludes the staff reports. Now, we'll open it up for, this is public testimony. And, we're gonna call first for, is there anyone in the room that I'm gonna go for people in the room and then, people on Zoom if they wanna testify. Okay, so I'm gonna call first to anyone in the room who wants to, comment in favor of the proposed, ambulance service plan. Is there anybody on Zoom that wants to comment in favor of the proposed ambulance service plan? Okay. Hearing none now, we'll call for comments in the room of anyone in opposition of the proposed ambulance service plan. Emily. And don't forget, we ask you to identify, state your full name for the record, town of residence as well, and then your affiliation, if you will, please.
Emily Roberts with Morrow County Health District. I apologize, I am not sick or contagious, I'm recovering from laryngitis. So. I have submitted written testimony on behalf of the health district, but I would like to orally summarize some of it. It is online if the public would like to read it verbatim. The first issue I would like to address, while Mr. Blackmore's opinion may be that it was inappropriate to administer the 1998 ordinance and plan under the health district and the EMS advisory committee, the Morrow County Circuit Court has actually upheld that that was a legally permissible process and that the EMS Advisory Committee in the Health District acted rightly when we sanctioned Boardman Fire Rescue District for their non-compliance with the 1998 ordinance. Implying not only that the administrative structure of the ordinance and the ASA plan was appropriate, but that the way that we were acting under it was appropriate as well. We have big concerns that the county has neglected to follow anything that was in the 98 ordinance and plan with regard to when the health district vacated services and with regard to the development of the new ASA plan and ordinance. We've outlined those concerns. For Mr. Blackmore to say yes, but we intend to repeal it so we don't have to comply with it is just simply not true. You may intend to repeal a law, but if you have not, you are obligated to comply with it. The map boundaries, when we asked Mr. Blackmore specifically about that, he did not have a CMS opinion that was specific to the health district, which is required in those types of situations. He had asked them a generic question that did not have the details of the situation. So that opinion cannot be relied on by the health district or by anybody else to say that we would not lose our cost-based reimbursement. And the facts that we have in front of us at this point, and that our CPA, who is actually an expert in this, where Mr. Blackmore is not, those facts lead us to believe that we would not be able to get cost-based reimbursement under this plan because it's not a 35-mile boundary from Pioneer Memorial Hospital. Additionally, the makeup of the ASA Advisory Committee continues to be a concern for us. You know, we've heard the county say several times that it shouldn't have EMTs and paramedics on it. Again, it administers the quality of the care of EMS services in our community. And I think it is very important that they be involved. And I think some of the decisions that have been made recently highlight the importance of having EMS experts involved. We now have very long response times. I believe there was a 5-hour response yesterday. And I think that if the EMS Advisory Committee had been involved in this process, we would not be where we are right now. Finally, with respect to the no implementation period for the new rules under Section 9, while Mr. Blackmore says that the Board of Commissioners will necessarily consult the public, I think politically speaking, in our community right now, a lot of people are saying that the Board of Commissioners are not listening to their feedback or acting on it. And so I don't think it's sufficient to just say, well, we will take it under consideration when there's nothing in the plan that says that you have to. And frankly, with the 1998 ordinance not being followed, even if there was, I guess I'm not certain that that would happen. So those are my concerns. The full list of concerns can be read online, and Mr. Nelson, I'll give you a copy as well, just to make sure that you have it for records. Thank you.
Thank you. Is there anyone else in the room that wants to speak in opposition to the ASA fund?
Jody Ferguson. I live in Lexington. I am happy to hear about the amendment to add Lexington, since I have an email from Mr. Jensen that requesting that we be added, and he says that the Board of Commissioners has heard the request at our meeting on 1/17 and he promptly directed staff to add Lexington. So thank you, I appreciate that. One of the reasons that I have issue with this ASA plan is the committee and how that is apprised, but also I'm a little disappointed that maybe you guys aren't looking at how things are running now. What are the response times? How are their backup crews? What's going on? To me, that would have been a great insight to how you actually run an ASA plan. And I think it would have been really important. And that I think it would help you moving forward to know what we need for coverage. We're not, especially in the South County, getting good coverage for any second out call. Maybe not even some of our transports. 3 and 5 hours with no backup, that's not appropriate. Part of the ASA plan talks about radios. We're not hearing if a second ambulance is coming and knowing if we have backup or not. I think that that's really important, especially if you want the support of South Morrow County. We should see a log. We should know what's going on. We should be able to see all of those things. Instead, I believe some of it's kind of being hidden by not being on the radio so that we know what's going on. And we deserve, and I believe the plan says that we have to have the same or adequate coverage. That really is worrying me about whether we truly will. If there is a need for a second out, calling Morrow County Health District's ambulances are the right thing to do for the people of the community. They deserve to have coverage, not worry if an ambulance is coming to pick them up. This isn't about pride and power. This is about serving the people in the community. And I hope that working through a new ASA plan is going to take those things into consideration. These are people's lives. This isn't about power and money, and I don't want anybody's help because I want it to all be me. Do what's right for our community members and their health.
Okay, thank you. Is there anyone else in the room that wants to speak in opposition to the ASA plan?
If I may, Dave, I would like to speak from here. I had struggled to get up.
Sure.
Okay,
Yeah,
I just have a question.
well,
Richard Gray.
you know, this is for a period for you to put statements about the ASA plan into the record.
I'm okay with that. If I can.
Well, you need to state your name,
Okay.
affiliation, if you have one, and what town you're from too.
Richard Gray, Etna, Oregon citizen. I'm still confused. And by Bob's own admission right there, I didn't see a plan that was broken. Why did you try to fix it? That's just a question I have, and maybe you can respond, maybe you can't. My dad died here when I was 12. The response time for him, he was clear out in the boonies. Nobody knows here where he was.
I'm sorry.
No,
Speak
it's not.
to the ASA plan. I'm sorry. Speak to the ASA.
I
plan.
am. His response time was less than 30 minutes, clear in the boonies. We had a response time of over 5 hours. How is that consistent with what we had before? There's no question. I'm done.
Okay, thank you. Okay, anybody else in the room? Anybody online on Zoom? Okay, anybody, you see any hands up there?
No.
Okay, so, that concludes the public testimony, so we'll close the public testimony portion of the hearing. And the commission will, make their decision too.
So this is the time to make the motion to add Lexington.
Yes. So if it's okay, if I could offer a motion, I would ask the Board of Commission to consider a motion to amend the ambulance service plan, specifically section 5, subsection J, subsection 2, which is JA2, sorry, which is and add in Lexington Volunteer Fire Department there for a total of 5. No.
Okay.
So you got that one? That is my motion.
Do I hear a second?
I'll second.
Moved and seconded. Any further discussion? All in favor?
Aye.
Aye. Motion carried. Okay. And second motion is.
Move for the certification by Morrow County of the county ambulance service plan.
And Bob, if you wouldn't mind raising your hand, I'm gonna pin you and remove your mute. Just to make sure we're doing it right.
So the first motion was fine. That was something you had to address. I think you need to address the certification by Morrow County of County Ambulance Service Plan. Do the commissioners agree, and it's on page 1 of the plan, that each of those statements is correct? And do you vote to approve those statements? Would you like me to read those statements?
No, I see so I guess I'm looking for the wording of the motion then is it just the, move for approval of the certification from Morrow County of the county ambulance service plan, or do you need more than that?
Correct. That's it. That's your motion.
Okay, so that, I do move for the certification by Morrow County of the county ambulance service plan.
I'll get a second, but been moved and second, any further discussion? All in favor? Aye, all opposed, motion carried, okay. And the third one,
So, we don't have this. I think that's to the ordinance, the motion to approve the first reading of the ordinance by title only. That's correct.
I think Bob, was there a question? I think it might be, Blackmore is exact wording, you think it would be appropriate for that motion? I don't want to step on toes and get anything messed up, so I know, Mr. Blackmore's been working on it. So if you had wording for that third motion you're talking about,
The
now,
motion, yeah, the motion would be move to approve the first reading of the ordinance by title only.
Second.
been moved and seconded, any further discussion? All in favor? Aye, all opposed, motion carried. Okay,
Your clerk, excuse me, your clerk now needs to read the title of the ordinance for the record.
I can do that. This ordinance shall be known as the 2024 Morrow County Ambulance Service Ordinance and may be so cited and pled.
just also referenced in the matter of enacting Morrow County Ambulance Service Ordinance, the repealing ordinance MC-C-4-98.
Yes.
okay,
So then your third motion is a motion to approve the ambulance service plan by title only. Your fourth
fourth,
motion.
that'll be our fourth vote.
Yes.
Fourth.
So just confirming for the title here, and so.
Yes, I am. I mean, that's just, okay, so we have a. But yeah, I think we're ready, so whatever you guys want to do, our title only, and then I can read the title after you guys vote on that.
So I'll move for approval of the first reading of the annual service area plan by title, which is.
This would be, this is the title I see, and Mr. Blackmore, correct me if I'm wrong, it's the Morrow County Ambulance Services Plan. That's just the title I see on it. There's another name for it, Bob?
That's it. That's sufficient.
I'll second.
Been moved and seconded. Any further discussion? All in favor?
Aye.
Aye, all opposed, motion carried.
Again, that'd be the Morrow County Ambulance Service Plan, title, 2004.
Okay.
Wherever the document is on, it's online, our packets here, and it is approximately 115 pages.
Does that cover everything, Scott?
That covers it.
Okay. Doing that, I'll close the public hearing. I'll close this public hearing and adjourn the meeting. You have some technical sign.
Yeah.
Sides of documents.